Basically what we see now in clinic is that we're increasingly recognizing that more of our patients are coming in without the traditional risk factors that we think of for head and neck cancer. Traditionally we think of head and neck cancer as being a disease of older men, of those with tobacco exposure, alcohol exposure, but some of our younger patients have none of those exposures, and it's become increasingly recognized that the human papillomavirus, or HPV, is the cause of their head and neck cancer. It seems to be clinically very important. These patients are younger and healthier than our HPV negative patients, and the treatment outcomes do tend to be different as well. We know that HPV positive patients tend to have a better prognosis from their disease. So we know that if a patient comes into my clinic with locally advanced disease that is HPV positive, I have a very good chance at curing their cancer. So right now we're not using that as a factor to select treatment options, but I think we will in the future. I think as we learn more about this cancer, we may be able to dial back a little bit on the treatment for these patients, possibly spare them some of the long-term toxicities that we know we see with head and neck cancer therapy.